All right, well, welcome again to the OptiAnalytics Navigate overview and portfolio of solutions, and we're going to do a webinar this week on OptiAnalytics Navigate. And if there are any challenges or concerns with the volume or anyone not able to hear, could you please let me know? And
I just let you know on the chat, but I'm still unable to hear you well.
All right, and would that be any better now?
Yes, sir.
All right, thank you. So I guess we're not muted, so that's fine too. We'll just leave the lines unmuted, and if anybody needs to comment, please feel free to do so. So I'm going to get started with basically, to begin, just an overview of the OptiAnalytics Navigate tools. Their OptiAnalytics family of products is made up of three different solutions, and just real briefly to, excuse me, to describe each of them, we have an Insight product, sorry, the Navigate product line, and then Spend. And the Insight is a product line and profitability analysis tool where we're looking at service line analytics and being able to look at cost and profitability for specific service lines. And then the Navigate, which we're going to review today, is the market share tool, looks at discharge data and does market share analysis. And then the Spend tool, which is looking at your PO spend within an organization, and you're able to trend that cost in those supplies based on your internal data. So that's basically an overview of what the OptiAnalytics platform. And then what I'm going to do now is go into really just a background on discharge data in general, so that people have an idea of what discharge data is made up of. So one of the things we talk about in many areas is data and many different types of data. So I just wanted to sort of briefly put it into three categories for each of you. That number one, we have what we call historical data, and this is events that have occurred in the past. And if you ever hear people talk about the Medicare data, state data, which we're going to talk about further, hospital claims, there's different types of registries, tumor registries, we have pharmacy data, lab data. All of this probably is historical in the fact that it was an event that occurred in the past. We're moving into more real-time data availability, which you have multiple medical devices in a hospital that are interfaced to patient management systems. You have your current EHR, which is your patient record, your electronic health record. And then you're having a whole lot of introduction of new wearable technologies that are also providing clinicians with real-time data. And then the future of where we're all trying to be is the predictive analytics. And what that is made up of is people, data scientists especially, making projections modeled on a lot of the above data. So you add population trends to some of the data that we've talked about before, and then you get into some projection capability or predictive analytics, also referred to as artificial intelligence. So one of the things I wanted to talk about is basically the state discharge data, and most of these slides I'm going to move into now are going to focus on data reported to the state, and it's going to include a lot of general information, and I think it's hopefully to help people better understand what it is, who uses it, and for what. So the first thing is it's a little bit, can be confusing, but what is a discharge? Very simply, it's anytime a person's released following a stay, inpatient or ambulatory surgery or emergency room, and each discharge is classified a certain way. And these are just some examples of the types of discharges that you could be classified under. You could be transferred to a SNF, a skilled nursing facility, home health. You can be discharged to a hospice, long-term care hospital, etc. So all of these events are the disposition of a patient following a procedure. So that would be basically what a discharge is. And then what the state collects, we refer to as state discharge data. And this includes, as I said before, data from an inpatient encounter or episode, outpatient surgery, same-day surgery, an emergency department procedure. But it's important to clarify that when you look at state discharge data, it's not an office visit. It's not claims data. It's actually an event that was a procedure and that someone had in a facility and then was discharged. So it's easy to get confused. Sometimes claims data can refer to just an office visit where you might have had a well checkup or something like that, and that would not be considered part of a data set that the state collects. And it includes a lot of information, which I'm going to get into a little bit more detail, location of where the patient lives, surgeon, the demographic characteristics, etc. So one of the questions is, how is it reported? And most of the states that are out, that are reporting data today, use what's called a uniform bill. It's the short term is a UBO4, and it's a claim format. And it's what they submit to the payers to be reimbursed. But the states have adopted this as more of a template. They don't use the entire form, but they use it as there's so much information in a UBO4 that the states are using this to process the incoming data as a template, so they didn't have to start from scratch. And as I said, it's mandatory in most states, and then there's also penalties for submitting it late or for if the hospital is inaccurate in their submission. So just to real briefly, this is an example of a UBO4. And then once again, this is just really just background on the types of data that we're going to be talking about, the state discharge data, to let you know a little bit about where it is and where it came from. And then we can show you how it's being used in a software tool like Navigate. But the data elements located on the UBO4 are used for the data collection requirements for the state. Now, I've just highlighted a few of them here, but each of these different boxes on the UBO4 form on the left correspond to something that's in the data file that the hospital has to submit. So this is just an example of the UBO4 and then all the different data points that are being collected. So after it's collected and sent to the state, this is an example of what would be a raw text, a raw file. This is just a test file, so it's not real data. But anyway, the test file is in this format, and as you can see, it would be somewhat cumbersome to interpret this, so you have to be able to take that and put it into a better format. Some of the fields that are in the data, as you can see, are, and I'm going to show a few more slides here, but you have the admission source, the admission diagnosis, patient's age, the CPT or the DRG primary, the length of stay, the patient ID, charges, zip code where the patient resides, the principal diagnosis. So all of these fields are in the data that we collect. The DRG group, an ICD-10 code description, gender, the hospital, if it's an infant, how old they are, etc. So once again, these are not all of them, but these are just a couple of examples to give you an idea of what's included in the data. And then, once again, we take this raw test file that I've shown you before, and now what we have to do is we have to normalize this and put it into a format that's easily understood and easily used by people in the field. So this would be an example of all that data, that raw file being normalized into a report and a map. And I'm going to get into some more further detail here. And on this example, we're showing some different tabs that are in the upper section of the view. Are there any questions at this point of what I've showed so far?
Makes perfect sense.
All right. So that's basically, what the data is, where it comes from. And then what I want to do now is get into the actual tool that we have, the Analytics Navigate. And this is really just sort of more of an explanation of what the actual tool does and who uses it and what it's used for. So it's really a dashboard application, and it's for viewing performance by a facility, by the discharges, and it's viewed at the procedure level. So we can, as you've seen before in some of those other slides, we can identify pretty granular levels of data, and then we can project that into a report and or into a map or a graph. So it really allows clients to get a really good understanding of their marketplace and where patients are coming from, because all the data is based on the patient origin or the zip code of where they live, and then what their diagnosis was. It's really as a planning tool. You identify the procedures, what's being done and where, what trends people may be seeing, like volume transitioning from inpatient to outpatient. Are there changes in payer mix? And a lot of times during open enrollment, this could be a time when you're going to see some shifts in some of your Medicare Advantage plans by different zip codes. So payers are very important to hospitals and ambulatory surgery centers. You're going to look at your performance versus a competitor. And this is one item that's, I think, probably one of the key takeaways of state discharge data, is it's the only place that a hospital gets to look at their competitor. And if you were in a private business, if you were running a store or something, there's no way you would ever be able to see the data that your competitor, how much they bill or how much they ship. So this is pretty unique to the healthcare world, that you're able to look not only at yourself and your own market and your own market share, but you're able to do the same thing for your competitor. So it really gives you an idea of where you stand from a market share standpoint in a certain geographic area. And you can also look at your physician business, where doctors are taking cases, and then people also want to look at this by payer. Some physicians might be taking commercial pay to a certain hospital if they're on staff there, and they might be taking their Medicaid or Medicare business to another facility. So it's important to understand the physician business and where they're going. These are some of the typical reports that people would be able to generate using the OptiAnalytics Navigate tool. You have market share capability. As I said, you can do a physician report. We have payer analysis. You can really do some extremely deep dives into diagnoses and procedures. And then you can trend over time, look at different peers from a comparison standpoint on a lot of different variables. And then we have what we call user-defined, which is more of a custom report that you would design for yourself based on what your needs were or what you were doing research on. So that basically is just an overview of state data, where it comes from, and then some typical applications, how people would use it, and then some of the different reports. So now what I'm going to try to do is get into the demonstration. Give me a second here. I'm having a difficulty getting it from full screen out of full screen. Here we go. Sorry about that. Everybody see the screen again okay?
Yes.
Thank you. There are two parts to the OptiAnalytics Navigate portfolio or functionality. One of them is a demographics capability, and what we have here is the ability to look at population, demographics, projections, ethnicity, income, occupation, et cetera, across the geographical area. And what I've done here is I've built a geographic area based on the Philadelphia market in Pennsylvania. And you can see up here we have some different tabs that we can select from. And right now I'm on the county zip code tab. So you can look at the population here by zip code, and it's based on the 2010 census. And then we have a 2017 and a 2022 projection. So I can change or adjust the zip code build that you see on the right-hand side, and then I can go to different tabs. This will be the gender tab, so I can look at the different age groups and what the gender would be, male and female, for those zip codes that I had previously selected. Just a straight age group listing without the gender. And you can see the breakdown there. It's color coded also. And then you can, this is scroll, you can scroll and look at all the different zip codes that would be in the tool. We have race, ethnicity, and these are basically just similar type tab using the same zip code build that I had created before, and then once again that would be customizable, or will you be able to build any sort of a zip code group that you would like. So this is an opportunity to get an understanding from a population standpoint and a demographic standpoint. What was there historically, what is there now, and then what will be there. And once again, these are all the projections and estimates based on the 2010 census. So a lot of this will change once we get the new census done, which I believe is coming up in 2020, I think. But anyway, this is part of the Navigate tool where we get into the demographics piece. So now I'm going to switch back to the Navigate tool, and this is going to be, now we're going to be looking at the state discharge data. So I'm going to be pushing this request against a pretty large database, so this might take me a second to load. And as you can see up here, it's right now it's thinking. So now I'm going to hit the Navigate tab, and then this is, once again, this is your login sheet. Login if you were going to use spend, or you were going to select either the Navigate tool or the demographics tool, and then our future product insight will also be loaded in here where you'd have access to loading that. So once again, this is going against a very large database. It would have a lot of different states, and I'll show you an example of some of those. So it takes a little bit of time to go into the first slide. We should be there in a second. Are there any questions? So this is it's going to show up to a default screen, and this would be a default screen that the user would typically set up. It would be based on perhaps a geographic area that they are accustomed to or familiar with. And in this example, once again, I'm still using the same zip code group that I had built for the Center City, Philadelphia area. So the first thing that you're going to notice is I'm on the market share tab, and the thing that's important here are probably the different facilities and then the number of discharges that they have, procedures, discharges they've done. And this is all based on a certain predefined time span. So what I've selected is 4 calendar quarters of data, so it represents 1 full year. So you can see the largest hospital down to the smallest. And I have this grouped by the top 50. And if we scroll down through here, we can see the numbers are obviously going to get less and less. But total was 473,000 procedures, and my largest hospital was Temple University. Now, if this service area was based on Thomas Jefferson, then Thomas Jefferson knows that they only have 7.95% market share in their primary service area. And it looks like Temple's taking a lion's share of that. But still, it seems like this is as a Center City area, it's pretty split between a lot of different hospitals and their market share. But this would be a simple example of how you would identify the number of discharges your facility had versus a competitor. And then you can also look at a heat map, and then I can click on each one of these zip codes, and I can see how many procedures were done in each of those zip codes. So if I just wanted to zero in on, let's say, this zip code right here, I could actually click on that, and now you'll see all the numbers over on my left side, the discharge column, all change, so that now I'm just going to look at the number of discharges each facility received out of zip code 19131. So that's an example of how I can now isolate a zip code and look at the number of discharges that occurred. So you can see that Thomas Jefferson's market share went down to 4.63% for that one single zip code. So that's just another way to use the heat map. And then you can also do similar functionality by just clicking on the facility. So I can click on Thomas Jefferson, and now you're going to see the whole map change to just reflect Thomas Jefferson's 37,000 procedures, 37,656. So you can see where they're getting most of their volume based on the heat map, and the darker color indicates a higher number, the lighter number indicates a lower number, but this is where they're getting most of their volume for Thomas Jefferson. So that's just an example of a simple market share report, and then understanding the number of discharges that are coming out of that service area. So most people are interested in how I would create this zip code group here, and so what we have to do is we have to go to an area called My Groups. And this is an example of how I can build any sort of a group that I would like to build. And as you can see here, I've built a zip code group that is called Hahnemann Primary Service Area. And if I wanted to change that, I could add or subtract, or I could bring in a whole new zip code group, and I could import a list of 10 or 100 zip codes, and I could create my own zip code group based on that. So I could build a new service area. A lot of hospitals would have a primary service area built, a secondary service area, and then they would also have primary and secondary service areas built for their competitors. So they could look at a competitor's market, and they can try to determine how many people are living in that competitor's market and are having procedures done at their hospital, and vice versa. Most facilities today are very concerned with what's called outmigration, and being able to figure out how many procedures are done by a competitive hospital by patients that live near my hospital. And for every one of those events, it's an important thing to consider that the revenue loss is extremely important to the CFO. So a lot of conversations with the CFO about these types of market analyses would be in reference to the revenue losses attributed to outmigration. So it's really important to understand the patients that live in a certain area having procedures done elsewhere, because each one of those events represent lost dollars to a facility. So as I said, there's different tabs here. Now I can click on the Physician Surgeon tab, and I'm going to now identify all the physicians or surgeons that did procedures or had discharges that were based in that geographic area. So now I've selected the attending physician, and I can switch this to surgeon if I wanted, but this is a listing of all the physicians and the number of discharges they performed in that marketplace, and then their subsequent market share also. So you can see that this Dr. McMasters has 0.8% market share for a single physician out of a pretty large geographic area. And I can show either the top 50, the top 10, and as I said, either attending, or I can switch that to look at the surgeon. And then once again, this is an extremely large database, so it takes a few seconds to return the data. but generally, pretty quick. The payer tab, which is going to now get into all the discharges. And if you remember, the original number of discharges we had was 473,000. So now it's basically showing that from a breakout standpoint, what were the top payers. So as you can see, we have a pretty significant population of Medicaid, HMO, PPO volume, and that's sort of a Medicaid managed care. And then your next is Medicare, and this would be probably Medicare fee-for-service, and then your Medicare Advantage volume, commercial, and this is your Medicaid standard fee-for-service, and then your standard commercial. So anyway, you can just see the different breakdown, and then there's people who are very interested in the length of stay by by procedure, by payer, and then the market share. So out of that geographic area, you have Medicaid, Medicaid Advantage with 37% market share, which is pretty significant. So if you're looking at your, your income, your margin from a CFO standpoint, knowing that your Medicaid volume is trending from year to year up, and those are patients that are coming to your facility, it's a concern. But the CFO would need to know this, so that's one of the areas that would be of vital importance to him or her, of what kind of payer mix I have in my market. And then I think, a lot of this research is really revolves around what the procedure was performed. So here's an example of all the different procedures that were performed, and they're using this heat map. We're moving from the most volume to the least volume, but these are the major diagnostic categories that we've identified as the top areas, and then these were the actual MSDRGs or procedures. So you can see I've selected the top 50 MSDRGs, so I can scroll down through here and I can see which ones are growing or the volumes are getting smaller, which ones are important to me. If I'm not a OB hospital and I'm not delivering babies, then these two here, first three aren't very important. If I'm very big in the asthma business, or I've just hired a new pulmonologist, or whatever the case may be, orthopedics, and I'm going to be very focused on the MSDRGs that are important to me. If I am focused on an MDC like respiratory system, then I can just click on this now, and I can, instead of showing all of the top MSDRGs, I'm just going to show the rankings of the top MSDRGs that are in the major diagnosis category of respiratory. So you can go back and forth and look at just these different categories. And then if I just wanted to select a single hospital, I could do that also. So if I wanted to go back and now I didn't want to look at all the hospitals, I just want to look at my hospital, I could go back to my groups menu and I could just select a single hospital, and then I would see the number of procedures that were done by that hospital. So then one of the other areas I just wanted to touch on was the analysis tab, and this is what we refer to as sort of a user-defined or a custom tab, because most of the time people are very interested in the specific procedures that are occurring inside of a zip code, and then the volume that I received for those specific procedures. So in this example, what I'm going to do is I'm going to go back to the My Groups menu like I was talking about before, and I'm just going to add a diagnostic category of, let's go with the circulatory system, the O5. And I'm going to back to that. I don't think I did that to apply that change. All right, there it is. I'm applying that group. So now I just want to look at all of the major diagnosis categories 05 that are in my zip codes by individual zip codes. So this is where you can start to get somewhat granular in your approach to to the market share analysis. So once again, this is going against a pretty large database, so it takes a second to return. So now you're going to see all these numbers change as that MDC 05 kicks in. So all those numbers just drop. So now I have 148 discharges out of 19102 that were in that MDC 05 category. So now if I want to actually see what was in that 05 category, I'm going to put the MDC in a column. So you see I've selected MDC 05. And now I'm going to look at the individual MSDRG inside that MDC. So as you can see, I'm going to get more and more granular. And then I can select anything from here I want to. I can select gender, I can select payer. But right now I'm looking at 19102, and I'm looking at all the different MSDRGs that are inside circulatory. And then I can look at another zip code, each zip code, so I can identify which of these is the greatest volume and which is the most important to me and my facility and whatever my strategic plan calls for. So you'll also see some of these grayed out or pinked out areas, and within each of these data sets there are certain restrictions where we aren't by law allowed to identify below a certain level. So the state of Pennsylvania, which is a data set I've collected, I've chosen to use, has a what we call cell suppression level or blinding below 5. So these numbers that are in this column here are going to be equal 4 or less, 4, 3, 2, or 1. So it's just an example of how states want to blind their data so that people can't figure out who that person was. So it has to do more with PHI and HIPAA on being able to identify a patient from a data set. So we're required to blind that below a certain number. But in this example, if I wanted to look at a certain, let's say I had this zip code here, 19120, and I wanted to now look at, is there a difference in age group, or no, let's say gender. So I can now select gender, and all of these numbers are going to be divided based, between how many procedures were male and female. So now I have zip code, I have MDC, I have MSDRG, and I have gender. So it gives a hospital or a planning department a pretty granular look at the types of data that are available, and then also being able to zero in on a zip code. And then it's all about, I think, planning, how many procedures you did, and you're going to try to extrapolate from there how many you're probably going to do in the future. And then, once again, where the volume is, that people live in your area or leaving for services elsewhere, things like that. So that's really just an overview of the tool and the capability. One of the other things I didn't show was the state selection, and this would be how a user would go in and select a different state, and then they would select a different date range. So that basically explains how the tool works, and I'm more than happy to answer any questions you all might have at this point.
Well, I do have one quick question. Are we confident that the hospitals listed, let's say listed on this page, do not have the capability of taking and normalizing the data from the original screen that you showed us where it looks so scrambled?
Yeah, I would say that some of the very large facilities take that data file from the state, and they have enough resources internally to be able to put it into a tool of their own. And then some hospitals would use a tool like that I've shown here, Navigate tool, and then some hospitals might not have a tool at all. they might try to take that file and have some of their people put it into Excel, which is very, very difficult to work with because it's such a large file. So I think they're all across the board, but I have to say that some of the larger hospitals would either have resources internally to work the file themselves, meaning IT resources, and then they would also, or have the capability of using a tool similar to the Navigate OptiAnalytics tool.
Okay, so if a hospital decided that they wanted to use this tool, let's say Methodist Hospital, about 2/3 of the way down your list there, and they decide they want to use us, can they see the data of all of the other hospitals that with which they are competing, so they can identify where they may have superior competitiveness?
Yes. Yeah, they can look at everything that I've shown here, plus areas that I haven't even, we haven't even touched on that get extremely in depth. But yes, they would have access to the entire state database for every procedure by every hospital, every facility, every ambulatory surgery center in the state.
Wow. Okay, I would think that would be extremely enticing for them to want to use this.
Yes, I would agree, and I think that's really an advantage for a planning or an analytical department of a hospital, is to be able to understand where they've been using historical data, try to use the current data that they have real time, and then try to use some of that to make some predictive analysis of where we may be in the future. But I think all three types of data sets are very important, and this historical state data set is as important as any of the other ones. So it's important that they look at this and have access to a tool that gives them visibility into all the state data. Thank you. Any other questions? Go ahead.
You may have mentioned this, but how old is this data? Is it in real time, or is it last year's data?
Yeah, most states release probably about 3/4 late, meaning that it takes that long for the state to get the data that's being reported, and then for them to put it into a format that can be used.
Okay.
That's basically their aggregation time. So most states are probably 3/4 delayed in getting this out. So right now, most states are in the process of releasing the first quarter of 2018. So it's historical, but it's not 2 years old. It's probably 2 to 3/4 delayed in getting out, but still pretty current.
Thank you.
Yes. Any other questions? All right. If not, we want to thank you again for your participation this afternoon. Hopefully it was beneficial, educational, and if there's any questions, please feel free to contact us here at Intalere, and you can also visit our website at www.getoptianalytics.com for more information. And with that, I thank everybody again, and have a great rest of the afternoon. Thank you.
Thank you very much.